Hi, I'm Nicole Turnbull, co-director of the Psychosocial Safety and Leadership Institute, and I'm really excited to be chatting with Melanie Wind from Perci Health today. We're going to have a chat about who Melanie is, what Perci Health offers, why this work matters, and how you can connect with her if you'd like to learn more. Melanie, thank you so much for joining the collective.
Well, thanks so much for having me. I'm super excited.
Yes, us too. And can you, for anyone who might not have met you before, just tell us a bit about yourself and your background?
My background is in tech. I've been for the last 25 years working in mainly data and analytics
Mhm.
space, very much in the tech space, and probably the last 10 to 15 years in the AI specifically space. My background is across government, insurance, and healthcare.
I see why you and Caroline get along so well. And can you tell us a bit about Percy Health and what you offer there?
At Perci Health, we have a product called Perci, which is an app that provides note taking.
Mhm.
It's a clinical scribe that provides note taking for allied health, so occupational therapists, physiotherapists, and other allied health professionals, as well as nursing
Mhm.
staff. And we're also expanding into carers for aged care, so providing note taking for after visits with home care and those kind of things. So.
Mm.
Yeah, very excited.
Yes, I'm already thinking about many organizations who will be interested in this. And can you tell us what makes your approach or the service unique?
Yeah, so we started Percy Health. My co-founder and partner is an occupational therapist,
Mhm.
and he's actually my life partner as well. And I could see that he was spending a lot of time taking notes. So he does a lot of rehabilitation work, complex injury management, support of treatment and care, and he was going back to work after dinner and essentially doing his notes. And one night I sort of walked in and said, "What are you doing?" And he had all these post-it notes and receipts with scribbles on them and serviettes and all these things. And he was basically, when he was out in the daytime, collating, like having phone calls, he was writing notes on whatever he could find and
Mhm.
doing his notes after hours. So we built Percy together from the ground up and with other allied health professionals with kind of a couple of key differences. One is they were involved in the process. So they were involved in co-designing to make sure it absolutely fits in their workflow and works for them. And also they helped with the training of the AI to make sure the notes were very catered to allied health and to the different allied health professions. And the other key thing was that was an absolute non-negotiable was that we needed a product that could take notes during phone calls because allied health in particular, they talk to the same clients quite often regularly. They're on the phone a lot. And so if, 30% of their time, they get, 10 or more phone calls a day and they have to take those notes manually, that's, it doesn't meet the whole problem. So that essentially Percy allows you to take notes when you receive calls or make calls, which was a massive game changer. Yeah.
Yes, we've been doing some work with some organizations in home care,
Mm.
and they have shared with us one of the challenges is the admin and the paperwork and pulling together exactly what you've just said. So it sounds like it's going to make, or it is making life so much easier for so many workplaces.
Absolutely. Yeah, and because my background is in government for many,
Mm.
many years and insurance, we built it with a privacy first and compliance first kind of approach. So all, data in Australia and with sovereign like AI that operates within Australia, those kind of things. So to make sure that
Yeah,
it's compliant. Yeah.
very important. Yes, thank you for mentioning. And why is this work important to you? What gets you up every day?
Yeah, so I've always been very passionate about tech and about AI, probably before it was sexy. But also, um, healthcare is very important to me. I mean, I have a partner who's in healthcare and I see the difference that they make, but the fact that they generally put themselves last.
Mm.
in and put their clients first. And so I'm really passionate about providing technology that helps those kind of individuals.
Yeah, I love that.
Mm.
And you kind of have answered this one, but did you want to expand on it further? What kind of organizations or leaders do you most enjoy working with?
Yeah, so I love working with allied health practice owners,
Mhm.
with aged care. So I've actually I've worked in aged care as well. So
Mhm.
like working with aged care leaders and the actual allied health professionals. And so yeah, OT practices, allied health practices, physio
Yeah.
practices, yeah, those kind of things as well as aged care and also, there's opportunity in the insurance space where we can
Mhm.
provide additional differences. So, and again, I have an insurance background, so I love working with insurance
Yeah.
leaders. Yeah, and
And
help.
does that include the NDIS as well, and NDIS
Yes,
providers?
absolutely.
Yeah.
So in the healthcare bucket, absolutely NDIS, and that allied health play a key part there, and also NDIS coordinators. Yeah, so.
Fantastic. And I thought Allied Health might have covered it, but not being au fait with the language, I wanted to ask that just in
Yeah,
case.
yeah. Well, it's sort of an extension, I guess, into the healthcare space. So anyone who uh, provides healthcare services or coordinates healthcare services, our clinical scribe is trained to understand healthcare language. So it's
And
targeted
it is
healthcare.
its own language, right?
Yeah, it is. Like most industries have their own lingo, but yeah,
True.
definitely healthcare, and also their own way of taking notes. Yeah,
Yes.
and extracting what's important in the conversation. Yeah.
Yeah. Fantastic. And for anyone listening today or for the community wanting to connect with you, what's the best way for them to get in touch?
Yeah, so you can email me directly.
Mhm.
You can go to our website, percihealth.ai, if you want to find out more, um, or LinkedIn. LinkedIn is great. Yeah,
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 fantastic. And I'll add all of those in
yeah.
the notes to the video as well as your digital profile so people can access that really easy as well. But thank you so much for sharing. Thank you so much for being part of the collective. And we're really excited to work together to be able to raise the bar for industry and be able to showcase the work that you do. So thank you for joining us.
Yeah, thanks so much.